First of all, I'm sorry if you're in pain. You're not the only one. I'm not a doctor and I hope you can get to one to listen and help you. If your primary care physician is not managing it, you can try your nearest pain management specialist. There are clinics in urban areas. How to deal with pain can depend on what is causing the pain and if it is from a recent injury. If you are not sure of the cause, see your doctor or specialist and get images. A doctor can rule out physical causes like dislocations, blood clots, hardware, infection, and osteoarthritis. I'm aware that some people can't take pain pills or are unable to get anything that helps, so this video will suggest some ways to hopefully help you cope too. You can skip ahead to 136 to get past the drug talk. Ibuprofen, like Advil, Motrin, and Midol, helps inflammation, and is good for muscle pain and joint pain. Experts now say you should not take it within the first 2 to 3 days after an injury. Try acetaminophen instead. Inflammation is our body's natural response to an injury and helps promote healing. There are also prescription anti-inflammatories that are stronger. Prescription narcotics like opioids, Vicodin, OxyContin, and codeine, can help with severe pain by blocking the feeling of pain in your brain. They don't help with inflammation. Often prescribed after surgery, you should take them only as directed for as long as necessary to avoid addiction. It can be hard to keep your pills where children can't get them. I suggest a small lock on a bag or suitcase as an easy, inexpensive way to keep your pills by you safely. There are also natural analgesics you can try, such as turmeric, valerian root, or magnesium. Joint injections include a cortisone shot is a steroid injection. It's often the first thing offered in a temporary fix. It tends to help with inflammation and pain but may be harmful for long-term usage. Gel injections are made of hyaluronic acid and help with arthritis or loss of cartilage. You may have heard of the rice method, which I have always used. No one ever said otherwise to me. Maybe it was accidentally sent to my AOL email account? In the first few days after an injury, like a dislocation or ankle sprain, rice used to be recommended. Now many are recommending the peace and love and meat methods instead, and to avoid harm. Let's look at these, I guess, and then move on to something hopefully less annoying. The RICE method is an acronym for rest, ice, compression, and elevation. Rest. If you can get away from work, away from stress, and relax, it may help. Sleep promotes healing. Pain can be aggravated by stress and tense muscles. Ice or heat. Use for 15 minutes at a time, and no more than 20. Which one should you use? Ice has been recommended because it helps with swelling, and therefore can reduce pain. It is no longer recommended immediately after an injury. Heat is better for relaxing stiff joints and muscles. They may use it in physical therapy but not for a fresh injury. Compression. Wrap the injured or sore area with an elastic bandage or tape. Elevation. Elevate the sore area. Instead, peace and love is now recommended to deal with swelling. It's meant to educate and address psychosocial factors in recovery. Let's look at the components. Protect. Keep moving but take it easy. Elevate the sore area. Avoid anti-inflammatory medication and ice for the first few days after an injury. Compression. Wrap the injured or sore area with an elastic bandage or tape. Educate. I searched this and it said, your body knows best. Avoid unnecessary passive treatments and medical investigations and let nature play its role. Does that mean I should quit the internet deep dive about my injury, and just put some dirt on it instead? The other part is love. Don't tell me I have to forgive the kneecap that just ghosted me. Load. Let pain guide your activity level. Optimism. Stay positive. Vascularization. Try to find cardiovascular activities you can do to increase blood flow. Exercise. Stay active. Additionally, some recommend the acronym MEAD to recover as fast as possible. Movement. Move the joint as much as possible. This can help decrease formation of scar tissue. Exercise. Gentle, targeted exercise encourages circulation. Analgesics refers to using natural painkillers like mentioned earlier. Treatment. Your doctor or physical therapist may recommend soaking, injections, or any number of treatments. The acronym HARM stands for what you should avoid. Within 72 hours of being injured, whether musculoskeletal or otherwise, avoid heat, alcohol, running or re-injury, and massage. Hopefully that wasn't too painful. Which have you been advised to follow? Let us know in the comments. Physical therapy can help with pain. A physical therapist can examine you and sometimes tell where some pain is coming from and relieve it. They may use massage, ultrasound, and exercises. Epsom salt comes in different scents that can help you relax, and it naturally relaxes muscles and relieves pain. I read that the magnesium in it can also help with a headache. Additional things to try. Try soaking in a whirlpool or a hot tub. Massage therapists are trained to help with pain. There's always acupuncture, meditation, and breathing exercises. Talking therapies can help with pain and isolation. Distract yourself. Movies, video games, stand-up comedy, kids, and friends can help. Take a course online or through your library or community center. Share your story about pain in a journal, online, or in a support group. The sleep cure for pain. Those are all real things that were recommended to me. I hope it helped or at least distracted you for a moment. Someone did have one more suggestion. Lose weight. That person will not be missed. If you can think of anything else that helps you, please leave a comment and let us know. Does your doctor listen to you or seem to believe you about your pain? Check out this video about when doctors gaslight patients. Peace out, my friends.